This week we are going to discuss attention deficit hyperactivity disorder, most commonly known ADHD. And with us today we have Dr. Lokesh, who is a child and adolescent consultant psychiatrist based at Mediclinic Ibn Battuta and Mediclinic Springs. Good to have you with us, Dr.
Thank
Lokesh.
you. Thank you, Harry.
So, could you please tell us what is ADHD and what are the symptoms of ADHD?
ADHD is attention deficit hyperactivity disorder, and there are three core symptoms of ADHD. The first one is hyperactivity, where the child or young person is can be very restless, on the go, full of energy. The second core symptom is problems with attention span and concentration. They have a short attention span, they could get easily distracted in the class. They find it really hard to complete the tasks on time when compared to the other kids in the class. So, some of these kids could be lagging behind academically. Right. The third core symptom feature is impulsivity, where some of these kids find it hard to think before they say something or do something, which then puts themselves or others at risk. They have poor sense of danger. So, not all kids have all these core symptoms. Some might have a more of hyperactivity and a bit of attention and impulsive problems. So, it varies from child to child, but these are the core features of ADHD.
And I guess ADHD is a common presentation among young children?
Yes, of course. It's a very common behavioral condition across the globe that we come across. Sometimes it can be missed in the form of so they might be just classified as being naughty. Okay. So it's important that they get proper assessment for them.
And at what age the symptoms become evident, given that most of the children below the age of 5 are either inattentive or restless?
Yes, and that's absolutely true. Not every child who is restless and inattentive would meet the diagnosis for ADHD. Although some of these behaviors are noticeable under the age of 5, we generally wait at least till the age of 5, to do a proper assessment, to get a better picture, a comprehensive assessment. So most often, we diagnose post age of 5. Okay. Yeah, that's okay.
And so, how do you diagnose the child having ADHD?
Absolutely, that's a very good question. Especially these are little kids and even younger people. So they might not be able to understand what's going on within themselves, and they might find it hard to explain their behaviors. So it's important that we meet the child and young person with the family to do a comprehensive assessment. We observe the child and young person in the clinic, their behaviors, especially based on those core features, hyperactivity, attention and impulsivity. There are some screening questionnaires we use. We give one for the parents, we give one to the teachers, and if the young person is old enough, mature enough, we give one to the young person as well to complete. After we receive them back, there's a scoring system to identify how severe their problems are, and if they meet the diagnosis or not. In addition to this, we also request for some school reports, which are equally important part of it. So it's a very comprehensive assessment.
And I guess the school reports, because you want to see the behavior exhibited in two settings, both at home and at school.
Absolutely, that's a very valid point, because the diagnostic criteria itself is these problems must present at least in 2 or more settings. It could be at home and in a social setting, at home, social setting and in school. So that's part of the classification.
Okay. So, how are we going to treat the child?
Yes. Now, as I said earlier, it depends on the severity of the symptoms. Okay. Not all kids, would need medication. So the severity is mild, moderate, and severe ADHD. The mild ADHD cases, we go for behavioral management as the first line, mild to moderate, and then we also give parenting techniques. We request the school to put the supports in place for the child to help with the core symptoms in school. Sometimes in school, some of the schools have a counselor or even an educational psychologist who can provide the appropriate strategies for this child and maybe even an individual educational plan so that they can tap into the full potential. So those are the first line treatments. We use medication in only moderate to severe cases of ADHD, where these symptoms are impacting on the child's behavior, both at home, social settings, and in school, especially if they are not achieving their full potential.
Sure.
Those are the cases where we use medication.
What type of medication we use to treat ADHD?
There are generally two categories of medication we use to treat ADHD. The first line is most often a stimulant group of medication. In the stimulant group, there are short acting and also slow release or extended release form. For any reason, if the child or young person is non-tolerant to this stimulant medication, we then consider a non-stimulant medication for these children.
How long do they have to do the treatment for?
That's a very good question that I get asked in the clinics. And again, each child, a young person is different. It can vary. But most often, the children on this medication might have to take till they complete their school period.
Okay.
And we continue to monitor, from time to time. And if necessary, we give breaks during school holidays.
So to sum it up, I understood from what you said is that the main treatment bulk would be psychological input, education for both the family and the school, as well as support, practical support for the family and at school.
Yeah, that's right.
Dr. Lokesh, thank you very much.
Thank you for having me.